Good afternoon. It's already 2 o'clock. We'll now start. Before anything else, I'd like to welcome everybody to this pep talk this afternoon. As one of the reminders, please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your beautiful faces in the video. Another reminder, after the pep talk, please take the online learning Kum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this shown here. I have placed the link in the chat box. Another reminder, 50 OLETE certificates, getting 50 certificates will entitle one mentee to a free voucher for ROJoson telemedical consultation like this. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. One, let's have, okay. 1, 2, 3. Okay, habol. Okay, one. Oh, everybody in. 1, 2, 3. I have a patient empowerment program in which I'd like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, depending on our enthusiasm and perseverance. My pep talk today is entitled Head and Neck Health and Wellness Awareness. This is in consonance with the DOH, or Department of Health Awareness Calendar. The last week of April has been declared as the Head and Neck Consciousness Week. The empowerment objective is for the lay people to have a basic understanding of the head and neck wellness in their health management. The contents of this particular pep talk will be the following. When and what is the Head and Neck Consciousness Week in the Philippines? What is the head and neck? What are the different types of head and neck disorders? What are the different causes? What are the realistic methods of prevention of head and neck disorders? What are the importance of head and neck self-examination? How to promote head and neck wellness? How to recognize head and neck disorders so that early consult and treatment will be promoted? What are the more common diagnostic procedures? And what are the more common treatment procedures for head and neck disorders? The last week of April, this month is April, okay? So the last week of April is Head and Neck Consciousness Week. This is on the basis of a presidential proclamation in 2008. This event, the Head and Neck Consciousness Week, aims to increase public awareness on the cancers of the head and neck region, which includes the oral cavity, nasopharynx, larynx, and thyroid, and to promote primary prevention, screening, and early detection and optimal treatment and care. So when you say Head and Neck Consciousness Week, in the Philippines, it's practically the same as Head and Neck Cancer Consciousness Week because, as mentioned in the presidential proclamation, it specified that it wants to increase public awareness on cancer. Kaya, dapat yung Head and Neck Consciousness Week, to be more specific, it should be called Head and Neck Cancer Consciousness Week, based on this proclamation. In the US, they have the Head and Neck Cancer Awareness Month, also in April, but this is for the whole month. Okay, so they don't call it Head and Neck Consciousness Week, they call it Head and Neck Cancer Awareness Month. More specified, and it's also for 1 month. In the Philippines, it's only a week or 1 week. So for me, when we celebrate the Head and Neck Consciousness Week, I would like to include as much as possible everything under this topic of head and neck. Okay? So for today, I would also include head and neck health awareness, health and wellness awareness. That's why my topic today is head and neck health and wellness awareness. Next week, I will be talking on head and neck cancer awareness. Okay. So, but for this week, we'll start with the health and wellness awareness. Okay. This is a personal modification of this Head and Neck Consciousness Week of Department of Health. So, what is Head and Neck Health and Wellness Awareness Week? So we will focus on this one, Health and Wellness Awareness Week. So it is a week to make people aware of the importance of promoting and maintaining the health and wellness of the head and neck. Okay. When you say health, it's a state of well-being, no disorder, no disease, and there is the constant promotion, restoration, and maintenance of well-being of the head and neck. Okay. So for this particular, this afternoon, we will be focusing on head and neck health. So the other implication of this awareness week will be, it's a week of empowering people on health and wellness of the head and neck. So I used two words here, health and wellness, but I like to use this interchangeably. So when you say head and neck health and head and neck wellness, they will be meaning this. It would mean the same thing. So head and neck wellness is a state wherein there is no head and neck issue. When you say issue, okay, there are no symptoms, no diseases, no fear, anxiety. Even in the absence of disease, kung minsan walang sakit, pero takot na takot, so that is already an anxiety disorder, okay, or the condition. So this might affect the physical, mental, social well-being, and also the socio-economic productivity of a person. So gusto natin, okay, when you say health, it's a state of well-being, walang disorder, walang disease, walang nararamdaman, natakot, na ganon, okay? So head and neck issue includes anything under the sun, but usually can be categorized into 3 categories. So number 1, may symptoms na referable or concentrated on the head and neck. Number 2, mayroong sakit talaga sa head and neck. And number 3, walang sakit pa, o baka meron, pero inuunahan na ng fear and anxiety. No? Particularly, baka sabihin nila, baka may cancer na ako. No? So even in the absence of a real disease. So how to promote head and neck health and wellness? So these are the steps. So we must know the basic facts on the anatomy and functions of the head and neck organs and tissues. So we must know what is considered or what are considered normal and what are considered abnormal. So we have to know how to recognize them, especially the diseases. And then we must know the basic facts on head and neck disorder and diseases, learn how to avoid them if possible, yung mga causes, no? Then prevention, prevent those that are preventable, because there are some head and neck disorders that cannot be realistically prevented, no? Pero majority can be prevented. Another way of promoting head and neck wellness would be to avoid the unwanted phobia. Kasi kumisan wala tayong alam, natatakot na lang tayo. So mas maganda may konting alam. So we must be well informed of the facts and information. And then the other one strategy is to consult the head and neck specialist as early as possible for any symptoms that may be suggestive of head and neck disorders and diseases. And lastly, have the treatment as early as possible for diagnosed head and neck disorders and diseases. So these are the steps to promote head and neck health and wellness. So let's go to the definition of what is head and neck. Head and neck refers to the region in the human body. The two regions we're talking about is the head and the neck region. The head is the uppermost, taas of the human body when the person is in a standing position, and the neck is just below the head and connects the head. The next region would be the chest already. Okay, so the neck connects the head and the chest. Okay, so this is the neck, this is the head, this is the chest. So on the surface, minsan tinatanong natin, ano ba yung boundary between the two? Wala tayong definite boundary, so we just have to draw an imaginary plane here. Okay, so just below the jaw, ang plane nito, yung panga, no? So this will be designated as the boundary between the head and neck region. So all parts of the human body above this imaginary plane belongs to the head, say taas. Those below are called belongs to the neck region. But mind you, okay, the boundary is just a designation. Relative lang yan, hindi siya fixed, no? Okay. So parang guide lang ito. Okay. So within the head and neck regions, there are various organs and specialized tissues. Marami yan, no? Okay. So in the head, sa head part pa lang, so these are the various specialized tissues and organs, the scalp and the hair, kasama sa head and neck yun, head, skull, the brain, facial skin and soft tissue, facial bones, eyes, ears, nose, mouth, upper throat. Upper throat, we refer it to the nasopharynx, means at the back of the nose. Then the throat itself, we call it the oropharynx. It's at the back of your tonsils. And then upper jaw, it's the ito yung tinatawag na maxilla sa taas. And then lower jaw, yung panga. Okay. And then mga specialized tissues, there are a lot of lymph nodes, the head, and blood vessels, of course, the nerves and the muscles. Okay, so these specialized tissues located in the head are part of the head. Now for the neck, okay, so you have the neck skin and soft tissue. That you have also lymph nodes here. Then you have the thyroid gland, the parathyroid glands at the back of the thyroid gland, and then the trachea or the windpipe, yung daanan ng hangin, and then lower throat. Then you have lower throat means the hypopharynx, just kasama na yung larynx doon, no? Okay. Esophagus, yung pababa, and mahaba yung esophagus, umaabot sa chest yun, pero this part is still part of esophagus, okay, the upper part. Then, of course, the other specialized tissues like the blood vessels, the nerve, and the muscles. Okay. So nakikita niyo maraming organs and tissues located in the head and also in the neck region. Now, what are the different types of head and neck disorders? Okay. So let me just say, the head and neck organs and tissues, specialized tissues, can be affected by any kind of disorders, any kind of diseases. So the following are the more common disorders: masses, mga bukol, lumps, okay, which can be cancers and non-cancers. Okay. Then injuries, yung mga nasusugatan, especially the skin, then obvious sa brain, no? Yung mga due to vehicular accident, due to gunshot wounds, no? Tumatama sa ulo, sa leeg, okay? Then inflammation and infection in that area, endocrine and metabolic diseases like those from the in the thyroid gland, congenital anomalies, nung pinanganak, meron siya yung mga abnormal configurations, structures, and nutritional diseases like yung mga kulang sa iodine can cause iodine deficiency goiter. Okay. So these are basically the 6 major categories of diseases. No? Okay. Then here, mentioned here, some are preventable and some are not realistically preventable, which I will explain later on. So realistic means of prevention will be, because as I said, merong mga injuries, inflammations, nutritional disorders, healthy lifestyle and hygiene and healthy diet can prevent all of these 3 that I mentioned. And then avoidance of smoking, avoidance of excessive alcohol. Now, usually these are the more common causes of the cancers of the head and neck. Okay. So these are the ways that we can prevent. Of course, vigilance against injuries, okay, trauma to the head and neck. What is the importance, or what are the importance and benefits of head and neck self-examination for Filipinos? So the single most important benefit of self-examination of the head and neck is early detection of diseases, if there is. Self-examination facilitates early detection of any diseases that may affect these parts of the body. In particular, it facilitates early detection of life-threatening diseases such as cancers and severe infection. Okay, so yan ang advantage of head and neck self-examination. So with their superficial location, yung head and neck, very superficial, kitang-kita naman. So which can, yung mga diseases can be easily detected by a person. Okay. So it's easy to do, yung head and neck self-examination. It takes less than a minute to do it. Titingnan mo lang yung katawan mo, yung ulo mo, yung leg mo, yung kakapain mo lang, and then it costs nothing. Libre naman, walang bayad, no? If you do it yourself. So for all the above reasons, all Filipinos should learn and develop a habit of doing self-examination of the head and neck throughout their lifetime. Parang sa breast self-examination, ganun din. No? So a simple, cost-nothing procedure which facilitates early detection of diseases in these parts of the body, which in turn is associated with a lot of health benefits such as higher chance of successful treatment and prevention that skip disfigurement and premature death, especially those with head and neck cancers. So what needs to be done next is for all Filipinos to learn how to do a thorough head and neck self-examination and to do it on a regular planned interval throughout their lifetime. As I said, parang breast self-examination din ito, no? So it can be done anytime. It can be done when the person feels or sees something unusual on his head and neck. It can also be done when a person does not feel or see something unusual. So cursory examination, tingnan mo lang yung ulo nyo, i-feel mo lang. So it is highly recommended that the head and neck self-examination be developed in a health habit starting at the time when the person does not feel or see something unusual, yet as this practice has a higher chance of detecting early diseases. So a regular head and neck self-examination can be done any time of the year, any time of the day. So gawin mo na yung habit into a monthly basis. So a day within the month should be identified as the day of head and neck. The basis for this day is left to the person who is committed to do regular examination. It can be very easy, okay? It's you just remember the first day or the last day or the 15th day or your yung mga birthday in the day, but every month gagawin nyo, pwede rin, no? So how to do it? just look for anything unusual. Yan lang, unusual. Yung alam, you always see your face, head and neck naman, no? So at the moment, it's usual. But once you notice something unusual, yan, alarm na kayo, no? So example of unusual change, findings will be change in the usual appearance of a previous skin mark or mole. Okay? May mole, sabihin natin, yung dating mole, malaki, nag-iba yung appearance, nagkakaroon ng mga dark spots or mga pale spots, etc. Then appearance of a lesion such as redness, mapula, rashes, wheals, wounds, and growth of the skin. Appearance of a bulge on the skin, which could be a mass. Use a mirror to facilitate doing the look part of the self-examination of the head and neck, particularly on its side and back parts. Kasi hindi nakikita yung sarili ninyo sa, even with the, just by looking at yourself, hindi makikita yung sa likod. Diba? So you need a mirror. So feel for anything unusual at the head and neck, such as soreness or pain. Palpate, after looking, palpate the whole neck, head and neck for anything unusual. So look for tenderness and also particularly masses. Yun ang palaging hinahanap natin. So once anything unusual is felt, is seen, or palpated, you consult a physician as soon as possible. For those unusual changes discovered on looking, I would advise take a pictures and show them to the physician during the medical consult. Nowadays, because of the very accessible na yung camera sa phone, just take a pictures of whatever unusual that you feel on your body. Yung mga, may mga konting changes na makikita sa litrato. So below are some examples of the head and neck diseases that when familiarize, basta makita lang ninyo, baka may clue na kayo. This can facilitate a person doing a thorough self-examination and may assist in deciding on the urgency of consulting a physician. So I'll just give you a sample. Marami yan. I'll just use samples of pictures just to give you an idea of what head and neck disorders are. Okay. So this is scalp. Okay. So you have a mass there, unusual siya, di ba? Okay. So fortunately, this turned out to be an epidermal cyst. No? Ang content nito, para may mga yung grasa, whiteheads, kaya cyst tinawag. No? Okay. So benign ito. Ang gagawin lang naman dito, tatanggalin lang itong cyst. Malaki na masyado, tatanggalin lang. So this one is another unusual lesion on the scalp of this child. No? So ito, ang history nito, madaling dumugo pag tinatouch, no? At may history siya na nasugatan siya, hindi lang gumaling, ng husto at naging bukol, no? So yan ang tinatawag na granuloma pyogenicum. So it's not a cancer. We just have to remove it through an operation, okay? At mawawala na yan. Ito, this is a talagang bukol, okay, mga anak-anak nito. So this is a cancer of the scalp, no? So ang gamutan nito, operasyon, no? Kasi hindi naman natin masasara itong balat nito kasi may pipiyok kasi because of the scalp. So we have to use skin graft, no? Para itakpan ulit yung scalp niya, yung sugat. Ito, pangit na ito na bukol. So we suspect this is cancer already. So napabayaan ito, dapat maliit lang maliit lang ganito, dapat pinatingin na at napabayaan na. Lumaki, ang hirap na operahan ito. So this is what we call the squamous cell carcinoma or cancer of the scalp. Another cancer of the scalp, tumors, mga ganon na pumuputok na, no? Usually cancer na yon, no? So usually operasyon, yan, no? Tanggal yan, may margin para hindi siya umulit, no? Ganito, and then itatapal ng skin graft, no? So you can see the importance of early pag maliit lang na nagpa-consult ito, maliit lang sugat, maliit lang yung tatanggalin, no? Kaysa dito ang laki-laki, no? Sa face naman, okay, example of a face, of course, unusual ito, may isang bukol siya dito. So this turned out to be epidermal cyst, fortunately, okay. And this one is also another buccal which turn out to be epidermal inclusion cyst, which can easily be removed. No? Ito naman, congenital anomalies, mga hemangiomas, no? Mga malformation of the blood vessels. No? Okay, ito sa bata. Ganito. Okay. Ito, neurofibromatosis. And this is a rare, not so common disease, no, of the face. No, this can occur anywhere, pero ito nagkaroon siya sa mukha, no, mas mahirap gamutin. Okay, another tumor here. Luckily, this turned out to be a verrucous vulgaris. Okay, yung mga parang warts na malaki, no? So yan, tinanggal lang yung warts, no? And then may reconstruction. Okay, example of yung mga wound does not heal on the face. Ito, maitim ito, no? Medyo brownish, maitim, no? So this turned out to be kumisan, pag maitim, you think of melanoma, mas pangit yung melanoma. Pero this turned out to be basal. Basal cell is one type of skin cancer on the face. Okay, so mas madaling gamutin, no? So operahan lang ito. Then, tatanggalin nito. Pwede may margin para hindi siya umulit. And then, siyempre, pag tinanggal ito, may sugat siya how to reconstruct. So, kukuha tayong konting balat dito, then ibababa dito dito, no? Kaya dito, kita niyo may sugat dito. Ito, binaba yung flap, no? Para maisara lang, no? Ito yung melanoma. As I said, pag maitim, suspect melanoma. Melanoma ang pinaka-delikadong skin cancer compared to basal and squamous cell carcinomas. Maxillary, yung upper na, I don't know anong tawag dito sa English. Maxilla, yung sa baba, panga, di ba? Okay. So dito, maxilla tawag dito, may bukol, no? So usually, this X-rays will be taken to check yung configuration of the tumor, at usually, ang pag-cancer usually is squamous cell carcinoma. So, ang operasyon, ang hirap nito, no? So, tinatanggal ito, yung bukol niyan, no? And then, sinasara, no? At least hindi masyadong deform ito. And then, maglalagay ng prosthesis. May mga prosthesis yan. Kung wala, lulubog ito. No? Okay, parang ganito. Ito yung bukol sa gingiva, no? Part of the upper gingiva is part of the maxilla, no? So tatanggalin 'yan, and then reconstruct, no? 'Yon. So ganoon, no? May prosthesis sa loob 'yan, no? Wala, lulubog, wala siyang ngipin na, no? Mandibular tumors, medium sa panga naman, no? Example, ito is sa lower part, panga, may bukol dito. Buto yan, matigas yan. Kaya buto, no? Okay, so pag in-x-ray, nakikita itong puti na ito. Ito, puti, no? Okay. So, adenoma-ameloblastoma ang sakit nito. Sa oral cavity naman, oral cavity consists of the lips and also the mouth itself, na the tongue, the mga buccal mucosa, gano'n, no? So here, an example of mucocele. May mucus, may laman na fluid, no? Madaling tanggalin lang naman ito. But dito, bangit ang tsura ng bukol nito, no? May growth na siya, matagal na, usually squamous cell carcinoma. Okay. So tatanggalin lang ito, and then kukuha ng hihiram ng konting lips sa itaas, then ibababa, no? So that's how we reconstruct that defect, no? Ito, example, ito medyo congenital anomalies. Pinanganak siya na malaki ang dila niya. Okay, macroglossia. And then ito, may sugat dito, matagal, ayaw gumaling. So this turned out to be cancer of the tongue. Okay. Ito, granuloma pyogenicum. Kaliko, napakagat na yung dila niya at nasugatan, hindi nag-heal ng maigi at nagkaroon ng bukol na may madaling dumugo, no? So, granuloma pyogenicum. Ito, mas okay lang ito, madaling gamutin at tanggalin lang naman yan, no? Nasopharyngeal cancer or tumors will be, when say nasopharyngeal, it's behind the nose, may isang space doon, which we call the nasopharynx. So, pwedeng tubuan ng cancer, no? Actually, it's probably the second most common head and neck cancer. First one is thyroid. The second one is nasopharyngeal cancer. No? Okay. So usually, hindi mo nararamdaman yan, wala kang nakikita, no? Malalaman mo lang na may sakit ka na nasopharyngeal cancer kung meron ka ng mga kulani dito kasi nag-spread out na. Okay. So with neck metastasis. Laryngeal tumor, yung mga larynx na may hoarseness of voice, gano'n, no? So usually tinatamaan yung larynx. So pag malala na ito, usually tinatanggal yung buong larynx. Pag tinanggal yung buong larynx, hindi ka na makakasalita, no? Hindi ka na makakahinga doon sa dating hinihingahan. So yung tinatawag na permanent tracheostomy, nilalabas na rito. Kasi puputulin dito yan no? Then, ilalabas, para makahinga isang tao, papasok yung hangin dyan sa trachea, no? Okay, bababa. So, to the baga. Cervical esophagus, from the throat, pag nag-swallow tayong pagkain, dadaan sa esophagus, then to the stomach. Ito yung tinatawag na cervical esophagus. This is the part of the esophagus that is on the neck part. Yung part ng esophagus still extend up to the thorax and up to this abdomen, no? So ito yung neck part, no? So you can see na may bukol dito, narrow ito. So pag kumakain ng pasyente, yung pagkain hindi makababa, no? Okay. So because of this tumor. Ito naman, another type of head and neck tumor would be parang beke, no? Dito sa malapit sa tenga. Okay. So but this one is a tumor in that area. So we call that parotid gland tumor, no? Parotid gland. Pag mas dito medyo sa ilalim ng panga, ito banda, we call it submandibular gland tumor. Okay. There are three pairs of salivary glands, yung mga nagpo-produce ng saliva. One is the parotid, one is the submandibular gland, the other one is sublingual. Ito ang pinaka-common area of affectation ng tumor, parotid, and then submandibular gland, and then in sublingual. Bihira naman yun. Pero pwede mangyari. Sa thyroid naman, yon sa gitna ng leeg, sa harap, usually pag may bukol, we consider thyroid. Usually, pag lumulunok ang pasyente ng isang tao na may thyroid tumor, itong tumor nito, gumagalaw ito up and down kasama sa swallowing. And then this one is a bukol here on the upper part. Dito usually ang thyroid. So on this upper part, medyo iba na ito. So we call that a common lalo na sa bata, is a congenital anomalies. We call that thyroglossal duct cyst. Another congenital anomaly sa neck sa mga bata, you have the bronchial cleft cyst, and then cystic hygroma, yun yung mga congenital anomalies ito, no? And then ito sa mga elderly, may mga lipoma, kabilaan, no? Pwede mangyari sa mga tao, no? And then this one is a skin lesion also. Okay. So this has to be examined properly by the physician. No? Sometimes, a lot of times, a biopsy may have to be taken. So this turned out to be not cancer, but ang tinatawag ito keratocantoma. No? Okay. Ito, may bukol sa leeg. So usually kulani ito in this area. And then this turned out to be TB of the lymph nodes. Okay? TB of the lymph nodes. Okay? May mga nana dyan sa kulani. Ito naman, may kulani siya. May isang bukol sa gitna dito. If you ask the patient to swallow, it moves up and down. So most likely thyroid siya. And since may concomitant kulani, so yung kulani is a sign of spread. So we make a diagnosis of thyroid cancer which spread to the lymph nodes. No? Ito naman, mapula. Once you see may mapula-pula ang balat, no, usually infection siya. No? Infection. So, infection sa panga, sa below, sa submental area. No? So, kung i-aspirate mo ito, ang makukuha mo. Ang gamutan nito is to the administration of antibiotics lang. Of course, the most common affectation disorder of the head and neck is still the upper respiratory tract infection, di ba? Alam natin yan, di ba? So examples are the colds, flu, and most recently the COVID, di ba? Okay. Okay. So these are examples of mga diseases, yung infection diseases, na? Okay. So my advice on the head and neck wellness is to do self-examination of the head and neck regularly and thoroughly. Self-examination of the head and neck facilitates early detection of any diseases that may affect these parts of a person's body. And once anything unusual is felt, seen, or palpated, consult a doctor, physician right away. Early detection and treatment of head and neck diseases is associated with a lot of health benefits, such as higher chance for successful treatment, matatanggal lahat, and prevention of disfigurement. Nakikita niya examples na binigay ko. Pag malala na, mahirap na i-reconstruct at maraming distortion ang mangyayari sa mukha, no? Sa ulo. No? And of course, premature death because of late treatment for mga cancer, usually mga advanced cancer. So what are the common diagnostic procedures? I'll just mention them. X-rays, if there's bone involvement, usually X-ray ginagawa, then ultrasound of the neck, particularly the thyroid, then CT scan and MRI kung di kaya ng ultrasound, biopsy, and then thyroid function test, then parathyroid function test. Now, for the treatment modalities, based on the diseases that we mentioned, may mga nutritional diseases, so we need nutritional therapy. No? And then medicine, for the infection, we give antibiotics, antivirals, analgesics if there's pain, and then hormones and anti-hormones for especially for the thyroid hormonal disorders. And then repair, if there's injuries, mga sugat, they repair. Extirpation of the tumor with or without reconstruction, yung mga benign and malignant tumors usually tinatanggal. And then, kung cancer, pwedeng dagdagan ng radiotherapy kung di natanggal lahat, then chemotherapy kung di na magamot ng o itadagdag lang sa surgery. So these are, I just give you a rundown of the possible treatment for head and neck disorders. So summary and takeaway, I won't mention this anymore. These were the things that I talked about earlier. And then takeaway in relation to patient empowerment, be always in touch with reliable medical information on head and neck health and wellness. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions in head and neck wellness in One Health management. So with that, I end my pep talk. I hope I have empowered you to have a better basic understanding of the head and neck wellness in your health management. So before we go to the QA, so reminder, please take the OLETE, 50 OLETE certificates, 1 voucher for ROJoson telemedical consultation. And then feedback, please place your feedback in the chat box during the open forum before we adjourn. And then let's now have a group picture taking before we go to the QA. Okay. Ready, set. One, two, three. Okay. 1, 2, 3. Okay. The floor is now open for questions, comments, consultations if you want, short consultations. Okay. Okay. Anything else? Okay. Do we have some questions on the chat box? Okay, no questions here. So any questions that you want to ask? Marla, are you raising your hands?
Yes, Doctor.
Go ahead.
Last Thursday, that was April 20, nagpunta ako sa isang ENT sa Manila Doctor, check up for my, kasi parang meron akong yung allergic rhinitis. Sabi ko sa doktor, bakit minsan itong leeg ko parang sumasakit dito ko sa left? Sabi ko, dito sa leeg, dito, doktor. Eh, ang sabi niya,
Wala.
The Bluetooth device is ready to pair.
oh. Eh, ano kaya ito, doktor? Dito sa left.
Ano,
Isa parang
nawala, naputol yung sound mo.
naputol.
Ano ka mo? Nagpumunta ka sa
The
doktor?
Bluetooth device.
Punta ako, doktor, sa Manila Doctor itong last Thursday. Narinig niyo na po ako?
Yeah.
Opo. Tapos, kasi nagpa-check up ako dahil para akong na-allergic rhinitis. Nagpunta ako sa ENT.
Okay.
Eh, tapos kinonsulta ko itong leg ko dito sa left. Dito. Sabi ko, doktor, bakit minsan sumasakit dito ko? Sabi ko, para bang nag-crack cramps na hindi ko maintindihan.
Okay.
Eh, sabi niya, parang muscle lang yan. Sabi niya sa akin, doktor, sumasakit lang daw yung muscle. Yun ang sabi niya, hindi ko naman na inano kasi yun ang sabi niya. Hindi naman na ako nag-further na tanong.
Bakit ka nagtanong?
Kasi nga, doktor, yung parang palagi akong may sipon, parang nagbabahin-bahin ako. Kasi yung kapitbahay ko, marami silang aso.
Okay.
Na-allergy ako dun sa amoy ng aso. Tapos minsan naglilinis sila ng mga aso nila, amoy ng sunrox.
Okay.
Siguro doon po ako na-allergy, kaya nagpa-check up ako sa ENT. Tapos sinama ko ito leg ko dito ba sa left, dito. Sabi,
Okay.
doktor, parang sumasakit dito ko minsan. Sabi ko, parang dito kaya sa aking ipin, kasi parang may ipin ako na gustong pabunot. Sabi ko, ay hindi yan. Sabi naman niya, kasi meron ako kasing ipin, doktor, na parang na root canal. Na may parang gusto ko nang patanggal, baka yun ang dahilan ba?
Okay.
Oh.
Okay. So anong gusto? Okay. Okay, consultation ito. Okay, quickly. So anong nararamdaman mo this past
Dito,
past few
doktor,
days?
ito,
Masakit.
parang hindi naman siya masakit na masakit. Para bang, minsan parang masakit, parang ewan ko, di ko masabi kung ano ba yung ano niya, parang naggaganon siya, parang matagal na rin ito, iniinda ko.
Okay. So, yung wala kang ubo, walang sipon?
Ngayon, may sipon ako, doktor, kasi nga meron akong allergic rhinitis. Niresetahan ako ng doktor ng pang-spray at saka yung Montelukast. Yun iniinom ko ngayon.
Kailan karang allergic rhinitis is not always there, di ba? Palagi, pag may atake lang.
Niresetahan ako ng...
Nagkaroon ka ng attack of allergic rhinitis lately?
Opo, dahil sa mga naaamoy ko na...
Sige, kung may attack ka, baka dahil doon.
Kasi parang palaging ako may sipon.
Kung may attack of allergic rhinitis, sasakit yung yung banda rito, yung throat mo.
Dito, doktor, sa left. Left lang naman, hindi naman sa right. Left lang, dito lang. Dito.
Pwede naman, pwedeng ganon. Pwedeng hindi pantay, no? Isa lang, no? Ganon.
Kaya sabi ko, pina-check up ko rin sa kanya, sinabi ko rin, doktor, sumasakit dito ko.
So, in-examine niya yung yung throat mo, yung ENT.
Doktor, parang sinilip na yung aking ilong at saka tenga. Hindi naman niya tiningnan yung aking throat.
Tenga, saka ilong, yung throat.
Opo. Tenga lang na, may sinilip siya. Tapos sabi nga niya, allergy nga yan, sabi niya. O di nireseta niya ako ng pang-spray na ano ba yung pang-spray na nireseta niya?
Ayun pala, kasi baka nakita niya, allergy lang yun. Kaya
Opo.
hindi na in-examine yung throat mo at binigyan ka na ng gamot, di ba?
Opo, kailan niya in-examine yung throat ko. Sabi niya, allergic nga yan, sabi niya. Allergic rhinitis daw po.
Okay. So, okay ka na ngayon?
Hindi pa nga ito, doktor eh. Parang hindi ko alam kung itong ipin ko ba ang parang matanggal para maano o ayaw naman akong bunutan ng dentist kasi kailangan ko daw ng clearance.
Okay. So meron kang ngipin dyan.
Opo.
Hintayin mo na mag-subside yung yung allergic rhinitis mo.
Opo.
No? And then, pakiramdam mo lang kung talagang masakit pa, baka dahil doon sa ngipin mo. No? Okay.
Opo, doktor.
And then, baka yung rin, sabi ng ENT, baka muscle pain, di ba?
Baka
i-exercise mo lang yung leg mo. Konting exercise lang. No?
Ano naman sa left? Oo.
Okay. Kumisan sasakit yung leg natin kung walang exercise sa leg. Parang tinatawag na stiff neck, no? Titigas yan, no? Okay. So, galaw-galaw mo lang, no? Okay?
Opo, doktor.
So, hope for the best. We'll pray for you. Okay.
Opo, thank you, doctor.
Okay. Any more? Any more questions? So how many have experienced head and neck disorder na? Marami na. Sino may thyroid?
Ako, operahan lang ako, doktor.
Natanggal na. Sino pa? Sino pa may thyroid?
Me, Doc.
Si Kat. Okay. Kat. Okay.
Ako, Doc.
You want to ask questions o yung thyroid? I can talk about thyroid today, pero yung extensive thyroid lecture ko some other days, no? Okay. Ito, overview lang ito ngayon, no? Okay.
Ano lang, Doc, most of the time, napansin ko lang, women's always have a thyroid problem because of the genes.
Ano?
Most of the time, women's have thyroid problem compared sa mga men.
Okay.
Bakit po ba? Because of the genes? And ask ko lang kasi, how come nung naoperahan ako, how come bumabalik po yung mga ganito, yung mga kulani po? Naoperahan ako last year.
Okay.
Yung ano po yung mga causes niya?
Number one, yeah, you're asking whether it's the gene. Gene nga, no? Kasi babae has different gene compared to lalaki, di ba? Okay. But why is it common in babae, no? Compared to lalaki? Honestly, I really don't have a very, very ano tawag doon, yung strong answer, no? Baka dahil sa marami kayong stress na pinagdadaanan, maraming stress, di ba? Because of yung mga hormonal changes sa katawan, no? Okay. So, parang marami kayong problema sa may breast, not only sa breast, the thyroid, di ba? Okay. So, sa lalaki, halos wala sa breast, pero kayo, pinakamarami, di ba? And then, of course, we don't talk about mattress. May mattress, mga ovary, no? Magkaroon marami ng problema dyan, di ba? Okay. So, I really don't know kasi ganun talaga yung statistics. It will show na mas mataas yung incidence. Most likely because of your hormones and stress, no? Okay. And then, the other one is, bakit bumabalik?
Yes po, Doc.
Bakit depende kung anong sakit no? Kung cancer, pwede siyang bumalik, di ba? Theoretically, no? Okay. Kung benign siya, pwede ding bumalik, pero mas bihira, no? Okay. So, just as we don't usually take yung yung pag tinatanong mo, bakit ako nagkaroon ng cancer? Bakit ako nagkaroon ng ganitong sakit? No? Mahirap din sagutin yan eh. No? So it all depends on a lot of factors. One is your genetic makeup. No? Number two, yung mga healthy lifestyle mo, kung exposed ka sa mga risk factors, then ikaw tatamaan. No? Pero a lot of times, we really don't know the exact cause. No? Kaya ako, ang personal stand ko is, number one, try your best to have a healthy lifestyle. No, no guarantee. I have to accept that there's no guarantee on that you won't get sick. No, so yung healthy lifestyle mo, kahit na walang guarantee, but at least when you do your healthy lifestyle, it can avoid, may mga 70 to 80% chance na hindi ka magkakasakit from any diseases. No? But hindi siya 100%, no? So usually mga 70, 80, no? Ganon. So tanggapin na lang natin na yung 20 to 30% talagang wala tayong magagawa, no? Mahirap i-predict eh, no? Okay. Okay?
Okay po, Doc.
Any more questions?
Ay, Doktor, may tatanong pa ako. Doktor.
Yeah, go ahead.
Tinanong ko rin doon sa ENT kung sabi ko, naoperahan na ako, doktor, ng thyroid. Sabi ko, babalik pa ba yun? Sabi ko, bumabalik po ba? Sabi ko, ano bang nangyari sa'yo? Sabi niya, total ba o ano? Total, doktor. Sabi, ay, hindi na yun babalik kasi total na daw, total thyroidectomy. Totoo ba yun, doktor? Hindi na daw babalik pag total thyroidectomy?
Ano bang, yung sakit mo, if it's benign, 1% chance na babalik. Okay?
Opo.
Wala, di ba ang usapan natin, walang 100%, walang 0%, no? Okay? Tama?
So, 9%.
99, the highest is 99. Okay? Okay. So yung pinakamababa, 1% or basta 0.001, ganon, no? Pero hindi pwedeng 0, no? Okay?
Opo.
Yan ang reality of life, di ba? So kung benign ang sakit mo dati, yung tinanggal sa iyo benign, no? Okay? Following the principle, there's no absolute certainty in anything. So I won't say totally na hindi siya babalik, no? Okay? So sasabihin ko sa iyo 1% or even less than 1%, na? Okay? Pero kung cancer ang tinanggal sa iyo, mas mataas ang possible chance of recurrence, na? Okay? So depende sa stage na naoperahan ka, depende dun sa type of cancer, na? Ganon, na? Okay.
Benign naman yung doktor sa akin, awa ng Diyos.
Ano?
Benign naman yung doktor na tanggal sa akin.
Okay, benign. Huwag ka na mag-worry. Huwag ka na mag-worry. Just, so less than 1% lang naman yon. Kung less than 1, it's as if hindi na mangyayari yon. As if, no? But as I said, only God knows. Di ba?
Opo.
Tama? So, umiinom ka naman gamot, di ba? Replacement.
Yung Eltroxin.
Okay. Any more questions? So I suppose lahat tayo may mga flu, may colds, no? That's part of head and neck wellness, di ba? Okay. So actually, yun ang pinaka-common problem natin. Yung flu, yung head and neck, yung sipon, ubo, di ba? Okay. So we know how to take care of that already. Tama? O hindi pa?
Inom lang ng tubig.
So pahinga lang, di ba? So kung yung viral flu, alam natin, yung COVID naman, alam natin na yung mga we just have to make iwas to avoid it, no? Okay. And then the other thing is to increase your resistance, di ba? Palaging increase your resistance, no? Through healthy diet, healthy lifestyle, and then exercise, no? Ganon, no? Okay. So hindi sa mga gamot-gamot, hindi yung do not rely on the supplement, food supplement, no? To increase your resistance, no? It's still your exercise, and healthy diet, yung natural diet. No? Okay? Okay. So,
Thank
ano
you po,
pa?
Doc.
Thank you, Doctor.
Yeah. Any more? Any more questions? Wala na?
Wala na siguro. Topic is
Ano pa bang, meron pa tayong 2 minutes. If you have any questions. Wellness. So next time, we will be talking about head and neck cancers. No? So I'll be focusing on the 4 common types of head and neck cancers, which are thyroid, nasopharynx, larynx, and ano ba yung isa? Nasopharynx, larynx. Kalimutan ko na yung isa. 4 yun eh. No? Oropharynx, oral cavity, in sa mouth. No? Okay? Okay. So fortunately, all of you have not, except for the respiratory tract infection, which is part of head and neck. Other than that, o yung iba may thyroid, no? So wala namang may head and neck cancer, no? And si ano. So there's one here. There are 2 which I won't mention names, no? Okay, may dalawa tayo, but who are not, yung isa underwent total thyroidectomy. Tatlo pala kayo na may thyroid dito, no? Okay. So I won't mention the names. They are in the group, no? Yung isa underwent total thyroidectomy and neck dissection. Yung isa total lobectomy lang. Ngayon may nakitang bukol on the left side, no? Which we are trying to investigate and try to manage, no? Okay. So, pero maganda yung prognosis ninyo, no? Maganda yung prognosis, no? Okay. So if there are no more questions, last call for questions, sharing of experience. So we'll be talking about the more common cancers next week. And then after that, we will be focusing on neck masses. So, and itong next three lectures will be more on head and neck. No? Okay. Okay. So if there are no more questions, let's call it a day. Wala na?
Thank you, Doctor. Thank you.
Okay.
Thank you so much, Doc.
Thank you.
Thank you, Doc.
Bye-bye.
Thank you, Doc. Thank you so much.
Ito.
Thank you po.